But when does life begin? I submit the answer depends an awful lot on the feeling of the parents. A powerful feeling, but not science. We now turn to some big international news that I know y'all are dying to get my take on. That's right, Kate Middleton, baby watch. The royal baby is due any second, and the world is waiting with bated breath. Journalists from around the world are camped outside the London hospital, where Kate is expected to deliver the future king or queen. The British press has been talking about a royal baby since before it was announced, before it was conceived, even before Will and Kate were married. When a pregnancy is wanted by the mother and father, their family, their community, even their country, it is easy to think of the bump as a baby. But not every pregnancy is a fairy tale. There are other stories. An ultrasound reveals severe birth defects. A child is raped and becomes pregnant. Another baby would jeopardize a mother's ability to feed her living children. A woman decides she does not want a child at all. These are different pregnancies. They're reminders that an unwanted pregnancy can be biologically the same as a wanted one, but the experience can be entirely different. Eggs are fertilized. Embryos implant, cells divide and multiply, fetuses grow. But when does life begin? I submit the answer depends an awful lot on the feeling of the parents. A powerful feeling, but not science. The problem is that many of our policymakers want to base sweeping laws on those feelings. Take Texas. Thursday, Texas Governor Rick Perry signed a bill that bans abortion after 20 weeks and imposes restrictions on abortion providers that could shut down all but 5 of Texas's abortion clinics. Supporters of the bill say it's about protecting women's health and reducing abortions. If they really wanted to lower the number of abortions, which is, I think, an admirable goal, they're going about the wrong way. According to the World Health Organization, abortion rates are the same or higher in countries that criminalize abortions. Prohibiting abortion does not stop it. Instead, women in those countries seek out unsafe abortions, and they are more likely to suffer medical complications and to die. So much for pro-life. Joining me once again, Chloe Angel, editor of Feministing.com. Now at the table, Dr. Willie Parker of Family Planning Associates of Chicago. Still with us, Blair Kelly, Associate Professor of History at North Carolina State University, and conservative radio show host Dave Webb. All right, I want to start with you, Doctor, because it does feel to me like this question of the initiation of life and also the discussion around fetal pain has a lot to do with emerging reproductive technologies in which people are often anticipating making a baby, and so they know exactly when the conception happened because it happened in the lab, and then they're testing ultrasounds and heartbeats much earlier than normal. I want to listen to Texas Governor Rick Perry saying something, and then I want to ask your medical scientific opinion about it. Let's listen to Governor Perry.
New research, advanced technology give prematurely born children a renewed chance at life. And I think that should give pause to all of us as we argue the definition of viability, consider the human impact of abortion. At 5 months, many studies indicate these children feel the pain of their own deaths.
Dr. Parker.
Not Abraham Lincoln. Someone once said that we're all entitled to our own opinions, but nobody's entitled to their own facts. And the scientific facts around viability are that before 25 completed weeks, it is very unlikely that any pregnancy can survive outside the womb. But more specifically, with regard to Governor Perry's claim about fetal pain, the best scientific evidence that we have shows that the very structures that are necessary to perceive or to feel pain aren't developed until 29 completed weeks, almost 30 weeks. So, for example, to have a bill that outlaws abortion at 20 weeks is long before a fetus is ever viable, and even earlier before a fetus could feel pain. Those are just the scientific facts.
So that's so. I mean, I think it's useful to put the scientific facts on the table. At the same time, I want to acknowledge that there's a faith claim about the beginning of life, and when I say faith claim, I don't just mean evangelical, right? I mean, so Blair, you and I are best friends,
yes.
And we were both there for one another's pregnancies,
yes.
And we both related to our wanted pregnancies as children before the first breath, right? I
Absolutely.
talk to your daughter, you talk to my daughter in utero. But those are claims about faith that still feel to me like they shouldn't be legislated.
Absolutely. I think we were talking about privilege before, right? Mm-hmm. And to think about the ways in which you and I had insurance, and we had spouses, and we had homes, and we had our health to a certain extent.
Yeah, right.
And it was still difficult. It was still a challenge. But these were our choices. And so I think that remembering choice and not trying to legislate. I mean, the one good thing about sort of a libertarian stance is supposed to be that you're for people making choices about freedom and really being able to determine their own destinies. And so I would love for folks who push libertarianism on one side to think about the liberty of women, to think about the liberty of the poor, to think about people who might make different choices than they would.
David, 60%, more than 60% of women who choose to end their pregnancies with a termination, with abortion, do so and they already have a child. So it's not that women don't know. It's not even that they're not willing to raise children. It's often because they are in very complicated circumstances. Why don't we trust women to make those choices? What is the inability to just let the law be silent on this?
Well, it's more complex than a simple answer. And look, we start from a point of agreement. If you reduce the rate of unwanted pregnancies, you obviously in the free market reduce the need for more abortions. We also have a position where both pro-life and pro-choicers agree that you want to reduce those abortions because, one, it's something the country believes in. And that's a lot of people. When it comes to education, we need to use that. The faith and policy, that's going to be an argument that's going on forever. But I'm with the doctors, so the facts on the table matter. Essentially, Texas, and I'm not a fan of fetal pain. I think that's more of a policy statement in making an argument for your side. But we have to look at the reality of what happens. This is a late-term abortion bill, which, by the way, most Americans are against late-term abortions. And there's even an exception in this bill for the doctor to make a decision if there's a threat to the life of the mother. So at 20 weeks, you're more than 50% through a pregnancy. I just want to be clear about this. You've been through education sonograms. You've had your blood tests, your genetic tests. You've had the opportunity for an anatomy scan. So there's virtually no way you don't know where you are as a pregnancy.
Which is why most women who have abortion, I just want to be really clear, these are mostly abortions that are occurring because of significant difficulty. I mean, in other words, the 20-week abortion is usually a woman who wants a child, but at 20 weeks, once you've had this information, is when you make this decision.
Section 171.045, exceptions, physician's reasonable medical judgment. So that is in the text.
But then you have to have a physician, which takes us back to the privilege.
Well, you are usually seeing a physician at that point.
Bill. It's not just a, quote, late-term abortion bill. This is an omnibus abortion bill. It closes a whole bunch of clinics.
How?
It means that
what clauses in the bill?
There are going to be no clinics.
Actually, that's exact. Okay, well, that's actually, we're going to take a break. We're going to take a break, and we've got somebody who we're going to go right into the heart of Texas because I want to answer exactly that question: how this bill closes clinics. As soon as we get back.
We have never invested as much in public education as we should have because we've always had kind of a private notion of children. Your kid is yours and totally your responsibility. We haven't had a very collective notion of these are our children. So part of it is we have to break through our kind of private idea that kids belong to their parents or kids belong to their families and recognize that kids belong to whole communities. Once it's everybody's responsibility and not just the households, then we start making better investments.
not every pregnancy is a fairy tale. There are other stories. An ultrasound reveals severe birth defects.